Hi, my name is Mallory Duvall, and today I will be performing a horse health check. A reason to do a horse health check is for overall wellness check of your horse, and also if you're observing odd behavior of your horse. The first step in my horse health check would be the mucous membrane. You can check this in the conjunctiva of the eye or in the gums of the horse's mouth. I like to use the gums on the horse's mouth because it is less traumatic for the horse. I will do this by pulling the lip up and looking at his gums. The things that you're looking for is that it is moist and that it is pink. If you have dryness or pale, that could be an indication of dehydration. If you have the gums being discolored, like yellow, could be a liver issue with either jaundice or liver failure. If it is blue, you have a low oxygen. You have a low count of oxygen in the horse's blood. If it is brick red, this could be fever. And if it is white, your horse could be in shock. These are all things to be looking for when you're checking the mucous membrane. While you're checking the mucous membrane, the next step would be to check the capillary refill. You can do this by lifting up the lip again, using your thumb, and placing it on the gum, and release it. When you do this, you see the color fade from the horse. When you push on the gum, this is when the color fades from the horse's gums. When you take it away, in 1 to 2 seconds, you want the color to return. This indicates that they have a good blood pressure and they're not dehydrated. The next step that I like to do is the skin pinch. This is a very simple and quick check of the dehydration. You can pull the skin up and release. What you want it to do is to snap back into its back where it is not tented anymore. If the skin stays up tented, this is an indication that there is some dehydration. But you also have to take into consideration the horse's age, as they might just be old and have a loss of elasticity in the horse's skin. The next step in my horse health check will be to find the pulse. You can find this underneath their jawbone on the inside. Once you have found it, which may take a second, you will use a stopwatch and count for 10 seconds and multiply by 6. During that 10 seconds, I counted 6 pulses, which is 36. That falls in between the normal range for a horse's heart pulse, which is 32 to 44. The next thing that I will check during the horse health check is the heart rate. This indicates the same thing as the pulse. What I will do is use a stethoscope and place the end right here behind the elbow against the chest cavity. Once I have found it, I will use my timer again to time for 10 seconds. I counted 6 beats, which is accurate because that is the same as what I found with the pulse. So that indicates that he has this pulse and heart rate are both 36 beats per minute. This falls in between the healthy range of 32 to 44. An elevated heart rate could mean pain, and that is an indication that we would like to address when found. The next part of my horse health check will be the respiration rate. This you will find by watching the horse's abdomen rise and fall with each breath. What you do is you'll stand away from the horse and watch the horse's side. I will use my stopwatch and count for 15 seconds this time and multiply by 4. This is because I like to be more accurate, and sometimes with only counting 10 seconds, it's a little bit more difficult. So I will watch and make sure that I can see his chest rise and fall. And once I have found it, I will start my timer. those 15 seconds, I counted 2 breaths. Multiplying that by 4, which is 8. The normal respiration for a horse is anywhere between 8 and 16 breaths per minute. Being because he is calm and relaxed right now, 8 is just fine for him. The next thing I'll check in my horse health check will be the gut sounds. This you are listening for rumbling and grumbling in the horse's gut. You do not want to hear rushing or no sounds at all, because both of these indicate something going wrong in your intestines. The 4 places that you need to check are the upper and lower quadrants on both sides of the horse. You will listen to this by either using a stethoscope or your ear pressed up against their side. I will be using my ear. What you want to do is you want to walk up to your horse and touch them to let them know that you're going to be here. Watching their back leg, I will press my ear up against his side. He has lots of sound, but nothing that would indicate anything wrong. Now I will listen to the lower quadrant. Again, he has rumbles and grumbles, but nothing out of sorts. You'll listen to this on both sides of your horse when you're doing your health check. The last step in my horse health check will be to find the temperature. You will do this by using a rectal thermometer, either digital or mercury. Today I will be using a digital thermometer because it is faster. Using a mercury, you'll have to flick it down and use it, and you have to tie it to the tail. But today I will be using a digital, which you do not have to do either of those things. The first thing that you will do is insert your thermometer into the petroleum jelly. Set your petroleum jelly down so it is out of the way. Come up behind your horse, touching them so they know that you are there. Lifting the tail, starting your thermometer, and inserting it into the rectum about 1.5 to 2 inches. You will then wait for the temperature to read. A normal temperature for a horse is 99.5 to 101.5. Having a higher temperature than that may indicate fever, and that could be a sign of infection. When doing your thermometer, you want to make sure that it is tilted at an angle so that it is at your horse's rectal wall, not in an air pocket, which could give you a false temperature. When it is done, you want to slowly pull the thermometer out and read it. This says 99.6, which falls right in the normal range for a horse. I will then take your thermometer over here and wipe it off. Then using rubbing alcohol to clean it for your next use. This is how you perform a horse health check.